Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. The Upstate New York Poison Center fielded more than 46,000 calls last year across the 54-county region that it serves. Almost 80% were unintentional poisonings. To understand more about how these emergencies are handled, I'm talking with Dr. Michael Keenan. Dr. Keenan is an assistant professor of emergency medicine at Upstate and also the assistant clinical director of the Upstate New York Poison Center. Welcome to The Informed Patient, Dr. Keenan.
Thanks for having me. It's great to be here.
Now, you're a medical toxicologist. Can you tell us about that specialty, toxicology?
It's a really interesting specialty. It's a relatively small field, but it covers a pretty wide range of presentations. It's the study of poisoning, and it really just looks at the effects of drugs and chemicals on the human body. And it covers a wide range of patients. One category of patient that we take care of is the accidental medication exposure. So a pediatric patient who gets into mom, dad, brother, grandma's medications, or an adult who maybe gets an extra dose of a medication or gets someone else's medications on accident. We also deal with drugs of abuse and things like that in the community. And some toxicologists also do some addiction medicine as well. Fortunately, in New York State, we don't have much of this being a relatively cold environment, but we do take care of environmental toxins as well. So things like snake bites and spider bites and things like that. We do have a couple of venomous snakes in New York State, but not many. So we don't see those very often. We also take care of people who have foraging misadventures. So say they are out trying to gather mushrooms or plants and they pick the wrong ones. So we take care of those patients. And then lastly, we take care of occupational toxicology. So people who are exposed to chemicals either in the workplace or at home.
Now, when an individual calls the Poison Center, what is the process? Who do they end up talking to?
When an individual calls the Poison Center, and we're happy to take calls anytime, we're free, we're confidential, and we're available 24/7. The number is 1-800-222-1222. And if you call that number, you speak to someone who's called a SPY. So a SPY is a specialist in poison information. And that person is usually a nurse. We also have some pharmacists and some physicians who serve in that role. And they're especially trained and certified in handling these calls. And they take the call, they get the initial information, and they typically manage the case on their own. But if the case is complicated or if it meets certain call criteria, then there's always a medical toxicologist or a clinical toxicologist on call 24/7 as backup for the more complicated cases.
How often are cases able to be managed at the home as opposed to having to have someone go to the hospital?
I think that's actually a huge benefit of the Poison Center. One of our main goals is to keep people home as much as possible. The majority of the calls that we get are from home, about 75% of the calls that we get. And the vast majority of those calls, about 67%, we're able to keep home and keep out of the hospital. This is a great benefit to the caller because it saves them the time and the expense of going to the emergency department. And it also helps to offload the overcrowded EDs by saving unnecessary ER visits. So that's, I think, really an important function of the Poison Center is to try and minimize those unnecessary hospital visits.
Now, if 75% of your calls come from private homes, where do the other 25% come from?
The rest of the calls come from hospitals. Sometimes patients will self-present to the hospital after an exposure, and then the hospital will call us, or unfortunately, we get a lot of intentional ingestions and overdoses, and they'll call us from the hospital for help managing those cases. So if we get a call from a hospital, we will provide recommendations to the hospital team there on how best to care for the overdose patient. And we will follow that patient throughout their hospital stay with follow-up calls, sometimes multiple times a day or at least once a day, depending on the case.
I know the majority of your calls deal with unintentional poisonings. What do the rest involve?
Unfortunately, the rest of the cases are mostly intentional suicide overdoses. Somewhere in the range of 15 to 20% of the calls are intentional overdoses with suicidal intent. In those cases, we obviously manage the initial poisoning, and then we transition over to more of a focus with psychiatry getting on board to try and help prevent it from happening again in the future.
Now, you analyze data from the previous year to look for trends and identify the most common substances involved in exposure calls. Was there anything that surprised you about 2025?
Nothing particularly surprising, which is always good. Common things are still common. The most common pharmaceutical calls that we get are for things that you find in your medicine cabinet. So things like analgesics, especially like acetaminophen or ibuprofen or aspirin. And the most common chemical exposures are for the common household chemicals like window cleaner or surface cleaner or toilet bowl cleaner. So nothing different there. But one kind of interesting national trend that's been changing over time is there has been a notable increase in nitrous oxide abuse nationally. I haven't noticed that as much here yet, but there is certainly signals of increased trend overall nationally, largely due to the readily available nitrous oxide canisters that people can purchase and unfortunately abuse.
I'm unfamiliar with these. Nitrous oxide, where would you buy this?
People buy it in a lot of different places. Head shops and smoke shops sell it. Sometimes you can buy it online. They used to be able to buy it on Amazon. I think that's largely been taken off of Amazon, but it's pretty readily available. And there's very limited legal restrictions surrounding it, at least in New York State. And it's becoming a more and more common drug of abuse nationally.
So, how do you manage someone with nitrous oxide toxicity?
It kind of depends. There's two different flavors of nitrous oxide toxicity. From a acute overdose standpoint, it's relatively straightforward because it's really just a simple asphyxiant at that point, meaning that the nitrous oxide is just displacing the oxygen in the lungs. And so the patient may pass out in large exposures, could have brain injury or even death. And those cases are managed with simple supportive care. The somewhat more interesting cases are the chronic nitrous oxide patients who develop what's called a functional B12 deficiency. The B12 in their body no longer works due to the effect of the nitrous oxide on the B12 molecule. And those patients can go on to develop bone marrow suppression, as well as some very interesting neurologic abnormalities with gait issues and sensation issues. And they can also develop some psychiatric issues as well, and possibly increased risk of different clotting disorders. The most important thing is stopping use. And then we'll sometimes give them B12 supplementation and some additional supplementations like methionine or folinic acid, depending on the case. But the most important thing is getting the patient to stop use.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with emergency physician and toxicologist Dr. Michael Keenan, the assistant clinical director at the Upstate New York Poison Center, which provides free help 24 hours a day at 1-800-222-1222. Are you seeing an increase in calls on cannabis exposures?
Yeah, absolutely. It's really unfortunate and interesting to see. I looked at the data recently, going back to the mid 2010. So 2017, for example, we had only one call the entire year for cannabis. This past year, 2025, we had 283 calls. So an exponential increase. Some of those are adults, but the vast majority are kids, and the vast majority are kids under 5 getting into edibles.
And what is the risk for children to the exposure of cannabis?
Kids can get really sick with it. And the problem is really twofold. One is that a quote unquote dose that an adult would use is a much higher milligram per kilogram dose in a child. So even a standard adult quote unquote dose is a high dose in a child. But then the second issue is these edibles, they oftentimes look and taste or are packaged in such a way that they look like a candy product. And I don't know any kid that only eats one piece of candy. And so these kids get into these packages and they eat multiple gummies or multiple pieces of chocolate. And so they get really, really large doses. And in large overdoses of THC and other cannabinoids, the child can develop seizures and they can develop respiratory depression. And we've had multiple cases that have required intubation and admission to the PICU.
So it can be a real emergency for little kids, especially.
Absolutely.
Now, what about fentanyl? Is that still a concern?
Yep, absolutely. Fentanyl and its similar synthetic opioid analogs are still the predominant opioid in the drug supply at this time. There was some hopeful national data recently that suggests that we may have reached a downturn in opioid-related deaths, and hopefully that trend continues. A big part of that, I think, is a couple things. One is an increased emphasis on harm reduction, which really is very important in patient saving. So things like test strips for patients who have substance use disorder to test their drugs beforehand to see if they had fentanyl in them, things like that, to avoid it if possible. And more importantly, things like medication-assisted therapy. So things like buprenorphine or methadone as adjuncts to help patients reach a resolution of opioid use. And so patients who are dealing with substance use, I really encourage them to reach out to their doctor, or there's lots of local resources here to help them reach recovery.
Earlier, you mentioned plants and mushrooms and foraging. What are you seeing there? What would the risks be with that?
Yeah, we're actually kind of getting into foraging season here soon. So especially the spring and the fall, we get a decent number of calls for accidental poisonous plant or mushroom ingestions. Especially with the pandemic, there was an increase in interest in foraging, and we noticed an increase in calls in that regard. Some of the more common errors that we see are ramp misidentification. So ramps or wild leeks are prevalent around this area and people forage them. But sometimes people mistake those for things like veratrum, which is a cardiac toxic plant, or lily of the valley or autumn crocus before they flower can sometimes look like a ramp. We get those calls not infrequently. And then for mushrooms, we get several poisonous mushroom calls each year. One of the more common situations for the mushroom exposures is someone who possibly moved here from a different country, and the mushrooms here that are poisonous look like the mushrooms where they're from that are edible. So we get calls not infrequently for these exposures. And the biggest thing with foraging, I think, is if you're going to do it, make sure that you use a resource and take the time to identify the plant, consult someone who has a lot of experience in it before going out. And if you have any doubt about what you're selecting, don't eat it.
Well, what should a person do if they were exposed to a chemical or ingested medicine by mistake or by accident?
Yeah, any medicine, plant, chemical, anything like that, give us a call. We're here to help them decide if they need to be seen. The one thing I will say is back 10, 15, 20 years ago, we used to recommend inducing vomiting. We don't recommend that anymore, so don't make yourself throw up or anything like that. We don't recommend reflex dilution with water or milk or anything like that. Just call us and then we'll tell you what to do next.
Well, let's go over the steps people can take to help reduce exposures in the first place or an unintentional poisoning. What is most important to know?
So a few different things. I think that the most important thing by far is safe storage and safe handling. So from a medication standpoint, the ideal place for the medication is in the original over-the-counter bottle or original prescription bottle in the child-resistant packaging with the label on. That way you know what the medication is, and it keeps wandering children away from the pills. I do understand that some patients, especially older patients with arthritis, may have trouble opening those bottles, and so they use the pill minders that have the daily pills in little containers, and that's reasonable. But if you're going to use that, make sure that it's appropriately stored up and away and out of reach of children at all times. Now, as far as chemicals go, same thing, making sure that the chemical is stored in the appropriate bottle and away and out of reach and locked away from kids. Some of the chemicals that are under your counter, a good example is toilet bowl cleaner. Even a small exposure in a kid can be pretty severe. So making sure that stuff is away and locked is very important. And then on the adult side, keeping it in the correct container. You'd be surprised how many cases we've had of someone who drinks antifreeze on accident because it was stored in a Gatorade bottle. So keeping it in the original bottle is so important.
Can you describe what careful medication use involves?
So on top of the storage, making sure you're taking medications as directed is so important. Some medications, even something as simple as acetaminophen that is over the counter and readily available, if you take too much of it and don't follow the directions on the bottle, you can have really severe negative outcomes. So making sure you take the medication as directed and making sure that you double check it as well. One common error that we have that can be really catastrophic is some medications are meant to only be taken, for example, once a week. A good example is methotrexate. That medication is usually prescribed once a week, but if you don't really pay attention and don't look at the bottle or the directions and accidentally take it every day, that can be catastrophic. And so really being very careful to look at the directions and follow the directions and take the medication as prescribed. The other thing that we get sometimes are medication double doses. So maybe you took a medication in the morning, you take it again in the evening, or you take a medication in the morning and you forgot and you take it again later in the morning. Those are usually okay, but always call us about those because some of those, even a simple double dose, can have issues. And so one way to prevent that is to either have like a checklist on your phone or an alarm on your phone so you know that you take it the same time each day and you don't accidentally take it twice.
Well, that's good information. Thank you so much for making time for this interview, Dr. Keenan.
Thanks for having me.
My guest has been Dr. Michael Keenan, an assistant professor of emergency medicine and the assistant clinical director of the Upstate New York Poison Center at Upstate Medical University. You can reach the Poison Center around the clock at 1-800-222-1222. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.